Real quickly, before we get to the statistics, a couple of announcements to cover. I believe John shared on Tuesday, but next week we have some great guests. Dr. Stephen Russell, a pediatrician at Complete Children's Health, who's also very involved with the Lincoln school system on criteria to get the schools equipped to resume school, will be here on Tuesday. And then on Thursday, Dr. John Stoiter, cardiologist from Bryan Health, will be here, and his focus is going to be on a couple of things, but one of them is on if young athletes get this, what are some of the things to get back into participation. Our drive-through clinic, yesterday morning, all slots were full for the next 3 days, so we did add some hours or a little bit of a time, and fit a few more tests into the allocated hours, so there will be 30 additional tests a day, bringing us to about 120 a day. That started this morning at 8:15, and we'll have this extended schedule through Saturday again. I think there's some spots open for Saturday yet, but things were filling up really quickly yesterday. It's worth noting urgent care remains a really, really good option for folks at our South 27th location, where people can just walk up. And they're equipped to do the same thing the drive-through is without appointment. Results, continuing to see a good turnaround time. Again, the Cepheid, kind of the top of our pyramid of testing, is about a 1 to 2 hour turnaround for in-house things. Then our other in-house option is about 4 hours. And since LabCorp has created their Kansas City option, we are holding steady at the 2 to 3 day turnaround time. So that's wonderful. Last announcement before the statistics, a couple of questions from the public have come in, and then also there's a ton of chatter out there on the changes in reporting in this country. I want to break it down for you. I kind of see it as 3 different routes for Bryan here. The first one, we're going to continue to report directly to the media and the public through these vehicles. We've been doing that. We will continue to do that to let you know exactly what's going on in Bryan. We also report data to the Lincoln Lancaster County Health Department. This will continue, and I suspect the mayor and Pat Lopez will continue to report the aggregate community reporting. And previously, we had been reporting through the National Health Safety Network, or the CDC, and as you've learned, if you're paying attention to what's going on nationally, this is changing. So here's what we essentially reported to the CDC through the National Healthcare Safety Network. It was confirmed cases, suspected cases, numbers, hospitalized, ED volumes, patients on vents, patients in ICUs, a lot of the stuff that we give you. What's new with the reporting to the Department of Health and Human Services is it's going to be all of these things. But what they're now asking for is medication usage and inventories, PPE usage and inventories, different staffing levels, number of vents in use, but then also number of vents available. And honestly, the reason for the change and the request for new information hasn't been really well articulated, but it looks like it's tied to a resource allocation component. That allocation has already, influenced how remdesivir and convalescent plasma has been allocated, and so forth. A lot of this is not required yet, so we're evaluating what we can do and what brings value and what is tied to needed allocation from our point. But those will be the 3 avenues we report. And I know people have asked, the CDC won't be, my understanding is, will not be pulled out of the process. They're just not the receptacle of data initially. So with that, we just want to continue to encourage people to wash hands, socially distance, wear a mask. I mean, we've been, saying this pretty consistently since early April as we learned more and more about this. It's safe to say we've collectively procrastinated as a society, and some have ignored it altogether, but all we can continue to say is please wash your hands, socially distance, and wear a mask. It is so crucial to our school, to our economy, to people's livelihoods, perhaps to football, and even perhaps winter sports. It's something we can all do. So if you do care, please wear a mask. With that, let's get to the daily census. Pretty busy here at Bryan. We are at, our midnight census was at 496 patients. As far as COVID testing goes, we have now tested 15,229 individuals, resulting in 1,829 positives, and we have 335 pending results. The number of COVID patients currently in the hospital still stands at 8. 6 of those are from Lancaster County and 2 are from outside of Lancaster County. Total in-house, so there's a couple more that are in-house and positive or pending. So we got a couple that are hospitalized but are just pending the result coming back. Great news is right now none of these patients are on vents, and all 8 are either in progressive care or general care, not in the ICU. So with that, I'll open it up to any questions. The only thing new on drive-through testing from a Bryan perspective is we did add the additional slots because yesterday, the next couple of days had filled up instantly, and we didn't want to turn people away. And I know there's other testing options in town too, but we added 30 additional slots today, Friday, and Saturday to meet the increasing need for the tests that have been being ordered by physicians and so forth. So. Again, just to recap, 30 spots per day on Thursday, Friday, and Saturday have been added. We have extended the hours to begin at 8:15 in the morning. And I know Thursday and Friday are full, and Saturday was, 35-40% full before we added the spots. So I'm guessing that's really filling up by now as well.